allows us to make sure that we've got the right patient information in the right clinical record, so that when the clinician treats the patient, they're using the right notes to make their clinical decisions on. So making sure that we've got the surname and the first name, the gender, the Medicare number and the date of birth correct. So sometimes the duplicate record will be created if the identifiers haven't been checked appropriately when the patient's been admitted or presented to the facility, and sometimes if the wrong patient information is filed in the clinical record and we distribute that around the facility, again it plays an important role for the right clinical decisions. In an emergency environment, because they're working with different forms of information, it's not all captured in the hard copy clinical record. So they'll be looking at the EDIS system, the Emergency Department Information System, and a hard copy record and other electronic information systems in conjunction with each other. So again, it's making sure that the right patient identifiers match. So it all comes down to that patient ID matching process and making sure that we're all clear with what those identifiers are and making sure that they all do reflect each other. Is making sure that we're checking the patient's details mainly by their date of birth and their name first as the priority, and then that will reduce the amount of duplications as well. So for us, being in health information services, it's the wrong patient information getting into the wrong patient's chart. So it's loose slip filing that comes down to us after the patient's been here. It's making sure that we get that right in health information services, but the majority of the clinical forms that have the patient's details on them will be filed during the inpatient stay. So that's where it's critical on the wards to make sure that process is accurate and that the staff are checking the label at the top right hand corner of a clinical form and making sure that's going into the right patient's chart at the time of filing. So when a patient presents to the emergency department and identifies themselves, the first thing that the receptionist should do at the counter is bring up the date of birth search. So ask the patient for their date of birth and their name, and that's the quickest and most accurate way to complete a search. If we put the patient name in only, sometimes there'll be variances to patient names, and that's where inconsistencies occur and another chart will be accidentally created. So the date of birth is always the best identifier to prioritise. Capturing the correct patient identifiers against the correct patient also means that we will receive the correct funding allocated for each episode. So unfortunately, if we get that wrong at the patient identification stage, we may actually be missing out on some funding which will impact the diagnostic related group, which is directly attributed to activity-based funding. So it's very important that we get the right patient identifiers against the right patient and actually capture that information correctly.